I'm Dr. Jackson Corley. I'm the inventor of Incrediwear, and today what we're going to learn about are the Incredibraces. This is the first thing that helped me get better, and I think it's really important for everybody to understand how each one of the products works and the components of each one of these products. This line can change people's lives, and this is the reason why you need to learn about this. If we can help a person without medication, if we can get these people to wear the product as an anti-inflammatory, to make their body heal faster, to recover faster. It could be from everything from carpal tunnel to post-surgically on a knee. It's just amazing. I want you guys to think about this. If you could increase your blood supply to any part of your body, what effect would it have on it? So if you have a problem with wound healing, what is that going to do? That's what you need to think about as I'm going through and explaining each one of these products. Because what happened to me was I have 3 herniated discs in my back right now. They're floating in my spinal cord. So what I need something that's going to give me support, but it's going to increase the blood flow all the way down to the disc level. And these are things that we need to understand about this technology. Inside each one of the braces, it doesn't matter if it's a wrist brace, it doesn't matter if it's a back brace, or it could be even underwear. It doesn't matter what the product is. Inside these products are elements that release electrons into you, negative ions, just like a semiconductor. And what we know and what we can measure is that when I heat this up to 68 degrees Fahrenheit, really important for you to remember, all of our socks, all of our braces take 68 degrees Fahrenheit. That's the catalyst that pushes the electrons off of each one of the elements, and then it goes into your body in an infrared wave. When it does that, it vibrates the cells. Just like I was vibrating my body, when it does that, that changes the energy level inside your body and creates a wave. Very similar to that earthquake on the bottom of the ocean creating the tsunami. Very similar to me just increasing the flow, like maybe from a garden hose to a fire hose. That increased speed and increased blood flow is going to have a great effect on any body part you put it on. The great part is those waves go, believe it or not, 3 inches deep into your body. So when you put on a back brace, are you going to have an instantaneous result? Well, it's going to feel good, it's going to give you support, but it might take 20 or 30 minutes before those ions get all the way down to where they need to go to increase the blood flow, to start getting rid of the inflammation. So when you put this on some people, certain products are going to have a different effect. So the back brace, the way that you put it on, it's a double pull around. So you put on one part first, then you double pull, make it not super tight, but you're going to have it tight enough. Now, if you notice, the bottom part is going to go down when it's a low back injury. However, if it's a thoracic injury, you want to turn it the other way so it goes up. And what that's going to do, it's going to give you more support higher to your back. There's no rule that says you can't do it one way or the other, but this is just the best way to do it as far as support is concerned. And you can see up here, what it's going to do is give more support to a different body part. So just remember that when you're giving advice to someone who's going to buy this particular brace, this is a brace that you want to use if someone is in extreme pain, they have instability, they're having troubles walking, or they have a fresh injury. This is the brace they want to do for their back. Once their back is good and it starts feeling better, then what they want to do is they want to move to what's called our waist sleeve. And this waist sleeve is a sleeve that when you put it on, it's going to go up as a tube and it's going to wrap around your body, but it's not going to support you as much. And if it doesn't support you as much, then what it's going to do is over time, it's not going to make you weak. You can wear this for everything from hip injuries. You can bring it down for a hip because it's going to fit just like a tube. Or what we found is we even have people post-surgical on chests that are wearing it as a tube top. That's the low back sleeve. This is what I wear to bed every single night. The next product we're going to look at, these are for your elbow or for your calf. How many people have calf cramps? How many people have problems with circulation where they've got varicose veins, or their veins are giving them swelling, or they have swelling in their leg? This is the product that you want to use. You put it on just like a sleeve. You can wear it on your lower leg. This particular product is great because it has the bamboo charcoal and germanium. You can just slide it right on and wear it just like a regular sleeve for tennis elbow. If you've seen some of the professional athletes, this is one of the ones that they use for weightlifters. It keeps the increased blood flow so your arms don't get as fatigued. It's a product that you want to wear day and night. You want to sleep in it. If you can sleep in it, your body's going to increase the blood flow and it's going to recover faster. This particular product is also made out of bamboo charcoal, but once again, we see the gray. So it has the germanium as well. It's turbocharged. It's going to really increase the blood flow and make your body heal super fast. We have another product like this that we came out with just recently, and it's called the Tech 3 sleeve. Same kind of concept. It's a lot thinner. It gives you way more support. It does compress you just a slight amount to hold the muscle in. It's more for activity. It's more for when you're playing tennis, or if you have tennis elbow or golfer's elbow. Great for any sustained activity. And if you think about it, one of the biggest activities where you're using your wrists is sitting at a desk working on a computer. So just think of the great amount of support and the increased blood flow you're going to get when you're doing that particular activity. But one of the other ones that's really important is dead arm from motorcycle, motocross, from doing a sports where you're using your arms, even skiing, bicycling, anything where you have to use your arms or you're contracting a lot. The great part about this particular product, you can really feel the difference. The hotter you get, the cooler it makes you. And we want you guys as reps in stores to do this, where you'll take somebody and you'll heat up their arm as hot as they can in hot water. Dry off the arm, then put on the sleeve. And everyone should be doing this. When you put on the sleeve, your arm's going to feel like an ice cube. It cools off. It acts as an ice pack almost. And so when you're doing physical activity on all of our products, as you get hotter, the more ions going into you, cools you down. But this one is especially that way. If you take a look at that arm sleeve that we just took a look at with the germanium, this is exactly what it looks like. You can see it on the arm. But I'm showing you this because we're also looking at the wrist sleeve. We do thermography where we take a look at the heat of the body, freezing cold fingers on somebody that might have Raynaud syndrome, or they might have carpal tunnel where they can't even feel their fingers, or even someone post-surgical that just had a cancer surgery and their lymphatic system removed. You put one of these sleeves on, and within seconds, it's going to increase the blood flow into your fingertips. This can be up to 17% increased blood flow. Your hands are warm within minutes. Next product line, we can see that we're looking at two products here, so I'm going to just do one at a time. When I started walking again after I injured my back, I started having knee pain. And so the second product that I actually developed was the knee sleeve. And you can see again, it's germanium. On the side, it has little stays. Those aren't for extra support. What they are is so the brace doesn't scrunch up. It's to keep it spread out. The more spread out it is, the more it's going to increase the blood flow in a greater area. Then the more increased blood flow, the less cytokines or chemicals that create pain, and the more you're going to get decreased inflammation. This type of brace is not just for people that are in pain, that are old from arthritis. It's for anybody. It's for anybody that has any sporting activity or any activity where they feel that might have some instability where they have inflammation. Next product line is right at the base of this. It's our ankle sleeve. And the great part about the ankle sleeve, if you've got plantar fasciitis, if you've got heel pain, if you have any problems with sprained ankles, put this on right away, because what's going to happen is that increased blood flow is going to go in, it's going to get rid of the swelling that automatically happens when you get an injury. Think about it, the very first thing that happens when you get injured is the cascade response of inflammation. Inflamed, gets bigger and bigger, heats up, starts pooling blood. When it pools blood, there's no way there's going to get oxygen and nutrients inside that area that's going to allow it to heal. So now what we're going to do is put the brace on right away. It's going to increase the blood flow. The next day, you might have a person that has a grade 2 or grade 3 sprain. Now the swelling's almost gone. You might heal 2 to 3 times faster. The last product we're going to look at is not really a brace, but it's super important. And the reason why this is important, and it's for males and females, is because if I can increase blood flow to certain parts of my body. So maybe I have problems with hip injuries, or I might have a problem with a growing injury, or I might have problems with prostate or impotency. This is the product that you want to try. We did a trial last May on 50 men. They wore this product day and night for 6 weeks. 6 weeks later, they had a 50% decrease in night urination. Not only that, but these same group of people, they had impotency. There was a 30% improvement in their impotency just in a 6-week period. We made these sports recovery pants not for people with prostate or impotency. We made it for athletes, because when you're wearing this product and you're doing physical activity, the hotter you get keeps you cool. The cooler you are, you're not going to sweat as much. You're not going to get as much lactic acid. And at the same time, what happens is it's going to increase your performance, because now you're going to have more blood and nutrients and oxygen to those cells. So it's an awesome product. But now what we're finding is we might have to rename it and not name it a sports pants, because most of the people that buy this are people that might have prostate impotency, or they just want to wear it as regular underwear. And remember, for women, same thing, just a smaller size. Feels great.